Listening to silence. It is a powerful form of communication in the therapeutic process and can convey a range of meanings, from resistance and anxiety to self-reflection and introspection. 3 types of silence in psychoanalytic therapy. Silence as resistance patients use as a defense mechanism to avoid revealing difficult or painful material, or to resist the analyst's interpretations. The analyst needs to be attuned to the patient's resistance and explore the underlying fears and anxieties that are driving the behavior. Silence as a transitional space, in which patient can reflect on their inner experiences and gain insight into their unconscious conflicts and desires as well as inner experiences. The analyst needs to be patient and non-intrusive in these moments, allowing the patient to explore their inner world at their own pace. Silence as communication may be used by patient in its own right, conveying complex emotions and experiences that cannot be expressed in words. Though silent, but patient continues to communicate non-verbally through their facial expressions, body language, and tone of voice, and may reveal complex emotions such as shame or sadness. Actions, or nonverbal behaviors, can be just as informative as words and can provide valuable insights into the patient's inner world. Body language can convey a range of emotions, from anger and aggression to sadness and vulnerability, which help to gain insight into the patient's inner experience. Dreams and fantasies can be seen as actions that reveal important aspects of their unconscious conflicts and desires. Analysts need to be skilled in interpreting the symbolic language of dreams and fantasies and helping the patient understand the underlying meaning of these actions. Transference and countertransference. The unconscious feelings and attitudes that the patient projects onto the analyst can also be seen as a form of action. Similarly, the analyst's countertransference reactions, or the unconscious feelings and attitudes in response to the patient, can also provide valuable information about the therapeutic process. Self-reflection for patient as well as therapist is essential for promoting self-awareness, self-understanding, and personal growth, which may be. Mindfulness involves being present and aware of one's thoughts, feelings, and bodily sensations without judgment or attachment to one's own internal experience and biases. Supervision, with a more experienced clinician in a supervisory role to reflect on their clinical work and gain insight into their own strengths and weaknesses as a therapist. Self-analysis. The analyst can use psychoanalytic techniques to explore their own unconscious conflicts and desires. Several examples of poor listening in psychoanalytic therapy. Interrupting. The analyst may interrupt the patient before they have finished expressing themselves, which can convey a lack of interest or respect and disrupt the patient's train of thought. Imposing interpretations. The analyst may impose their own interpretations onto the patient's experience, which can undermine the patient's sense of agency and hinder to work through their conflicts. Failing to attend to nonverbal cues. The analyst may fail, such as facial expressions or body language, which can provide important information about the patient's emotional state. Engaging in technical errors. The analyst may not be skilled, such as active listening and reflective commenting, which can hinder their ability to listen effectively and promote healing and growth. Several examples of how psychoanalytic listening skills can be applied to non-clinical situations. Personal relationships. Listening skills learned in psychoanalytic therapy can be applied to personal relationships, such as romantic partnerships, friendships, and family relationships. By practicing empathy, attunement, and curiosity, individuals can improve communication and deepen their understanding of others, leading to stronger and more meaningful connections. Workplace interactions. Effective listening skills can also be applied in the workplace, such as in team meetings, performance reviews, and negotiations. By practicing active listening, individuals can better understand their colleagues' perspectives and needs, leading to improved collaboration and productivity. Political discourse. Listening skills can also be applied in political discourse, such as in public debates, social media discussions, and community organizing. By practicing empathy and curiosity, individuals can better understand and connect with those who hold different political views, leading to more constructive and meaningful dialogue across differences. By cultivating self-awareness, self-understanding with the art of listening, analysts and patients can create a more meaningful and effective therapeutic relationship that promotes healing and growth. Thank you. Thank you.